are you today?
Good, how are you?
Good. My name's Mary. I'm going to be your student nurse for your physical assessment. Can you just confirm your name and date of birth for me, please?
Dylan McFarland, September 25th, 1998.
Okay, I'm just going to check your wristband to confirm. Thank you. And do I have permission to record you today?
Yes.
Okay, great. Thank you. So we're just going to start with quick vital signs. I'm going to take your blood pressure, your pulse, and count your respirations, okay?
Okay.
Okay. Have you had any surgeries in your arms or lymph nodes removed that would make it so I can't take your blood pressure in that arm?
No.
Okay, and do you have a preference?
No, you can just use my right.
Okay, thank you. Go ahead and turn it out. Thank you. Would you mind holding that one for me? Thank you. All right, got 118/70. That's in the normal range. That's very good. Thank you. And then, can I have your arms take your pulse, please? Okay, so I got 70 for your pulse and 14 for your respirations. Those are both in the normal range.
Cool.
So I just have a couple questions to ask you now. Do you know your name?
Dylan.
Do you know where you are?
Your house.
Do you know what we're doing here today?
A physical assessment.
Okay, and do you know what the date is?
The 4th of April.
Okay, very good. You're completely oriented. Just a few other questions. Are you a student? Do you go to work?
I'm a student.
Okay, and do you feel safe at school?
Yeah.
Okay, and do you feel safe at home?
Yeah.
Okay, thank you. So next thing we're gonna do is I'm gonna assess your head, starting there, and then we're gonna move down. A little later in the exam, I'm gonna have you lay down in the bed. But for now, you're good where you are.
Okay.
Okay, so I'm gonna feel you. If you get uncomfortable at any point, please let me know, okay? All right, so I'm gonna feel your head. I'm just looking to see if you have any lesions. Do you feel any tenderness?
Mm-mm.
Okay, and I don't feel any masses, that's good. If you feel pain or tenderness at any point, please let me know, okay? All right, I'm gonna look in your ears now. Feel them first, and then we'll look both sides. All right, those are good. I'm gonna feel your lymph nodes. Do you bring your shoulders up for me? All right, don't feel any lymph nodes, that's normal. I'm gonna come back to your face. I'm gonna feel your sinuses. Do you feel any pain or tenderness?
No.
All right. Now I'm gonna look in your nose. Do you turn your head up for me? I don't see any holes or deviations. That's very good. There's no foreign objects in there. You need to look in your eyes. All right, can you follow my end of the light for me, okay?
Mm-hmm.
All right, very good. Your pupils are equal, round, reactive, and accommodation. I'm gonna pull down on your eyes and look in your conjunctiva, okay? All right, both sides are pink and moist. Very good. Could you stick your tongue out for me? All right, and can you say ah? All right, very good. Your buccal mucosa is also pink and moistened. Could you just stick your tongue out normally? You don't need to open your mouth. Just, all right. That's in the midline, so that's very good. Okay. Next, I'm gonna have you take your shirt off if you don't mind. We're gonna palpate your chest.
Alrighty.
All right. Before we start that, can you smile for me? And can you frown? And can you puff your cheeks out? All right. You can put them down. Can you push your head against me? All right. And the other side. Okay. Very good. And then can you do your arms? Can you raise them forward? And put them down to the side. All right, put them down. Very good. And can you push your shoulders against me? All right, good job. So now I'm going to go ahead with your chest. I'm going to palpate for any masses. If you feel any tenderness, let me know, okay?
Okay.
And then we're going to do it on the other side. I'm actually going to start on your back, so could you turn around for me?
Yeah.
You can sit in the chair. Alright, thank you. Could you turn for me so I can still get you in the camera? Thank you. Do you feel any pain or tenderness?
No, ma'am.
Alright. Now I'm going to listen to your lungs. Every time you feel my stethoscope, could you breathe in and breathe out for me?
Yeah.
Okay, very good. And then can you lift up your right arm? We're going to check your lower lobe on this side. Can you breathe in, breathe out? Alright, very good. Thank you. So I'm going to go ahead and have you turn around for me. You can get back in the bed. Thank you. And I'm going to do the same thing on this side, okay?
Okay.
Gonna first palpate.
Still breathe.
Yeah, could you sit up for me? Thank you. Feel any pain or tenderness?
No.
Alright, very good. And yep. So I'm gonna put the stethoscope back down. The same thing, breathe in and breathe out, okay?
Mm-hmm.
Alright, very good. So now I'm gonna have you lay down at a 45-degree angle, okay? So you can stay in the pillows,
This?
like flat. 45-degree angle. Could you bring the pillow over again for me? Thank you. And I'm gonna check for jugular vein distension just to see if visible at all. And can you turn your head so I can see the other side? Alright, very good. And then I'm going to get rid of the pillow so you can lay flat for me, okay? Alright. Now I'm going to listen to your heart, alright? So I'm going to use the diaphragm first, and then on the way back up, I'm going to flip and use the bell side to listen for any abnormalities, okay?
Okay.
Alright, I heard S1 and S2, that's normal, very good. I'm going to check again on the way up, okay?
Okay.
Alright. Sounds very good. I didn't hear any murmurs or abnormalities. Could you go ahead and sit up for me? That was the conclusion of our assessment. Do you have any further questions?
Nope, that's it.
Alright, thank you. Good,
Thank you.
good job. Thank you.